Hello, and thank you very much for being a part of Black Midwife Day at the state capitol under this golden dome. You know, so many of us, believe it or not, who are sitting House and Senate members were delivered by midwives. Or we've touched a midwife. My grandmother and my great-grandmother right here in Georgia were midwives. But they help so much, and so much more needed now than ever before. That's why I was happy to introduce legislation, Senate Bill 546. Senate Bill 546, and it is moving on the Senate side. And I'm so happy to work with the legislators from the House side, namely Representative Park Cannon, who has also been working on this, and you're part of the profession.
Yeah.
And it is a profession. And we do have so many midwives who can deliver our babies, especially in times like this with so much COVID and other pandemics that just pop out of nowhere. We need professionals who love us and who want to care for us and deliver our babies. So I'm going to yield to Representative Cannon for her great work that she's doing on the House side. But you know, it takes the House and the Senate to come together to make a law. And that's what we're doing, working together for the best of women and children all over the state of Georgia. Thank you.
Thank you, Senator James. Thank you to everyone who has been a part of the planning and the execution of Black Midwives Day in Georgia. We are a part of a number of states across the country on today, being clear that midwifery is a sacred profession and a practice that should be legal in all of our states. As we stand here in Georgia, we are doomed with the fact that mothers and babies are not facing safe experiences in hospitals. And even if they are experiencing safe experiences in hospitals, they have the understanding that there is just something more culturally appropriate, that there is something better about the home birth experience, or possibly a birth center experience, or even a hospital experience with a midwife. Which is why today we are talking about the important statistics related to Black midwifery. And I am so proud to be standing here with Georgia's longest serving midwife, Ms. Salama, who continues to share with us these staggering statistics. In 2023, the number of midwifery attended births rose from 9.6% in 2016 to 11.9% in 2021, and it is estimated that an increase in midwifery led to the decrease in stillbirths by 26%, the decrease in maternal deaths by 41%, and the decrease in neonatal deaths by 39%. Whereas the institution of midwifery has a huge debt to pay to the legacy of Black granny midwives in this country. We know the history. African women who were forcibly kidnapped and enslaved upon their arrival in this country brought with them the traditions and healing of midwifery. And prior to the Civil War, these midwives were responsible for bringing the babies of enslaved women into the world, as well as the babies of their slave masters.
Yes.
After emancipation, many of these midwives continued to practice within their communities and became known as granny midwives. They were prominent in southern states, including South Carolina, North Carolina, Alabama, Louisiana, Tennessee, Kentucky, Oklahoma, Texas, Florida, Missouri, Arkansas, Virginia, West Virginia, Maryland, and our state right here, Georgia. And during that period, granny midwives attended more than 2/3 of Black births in those states. We know that in 1930, there were 3,000 registered midwives in Georgia, but unfortunately those numbers have significantly declined for a multitude of reasons. We have continued to see there be legislative action to make training and licensing a requirement to practice midwifery. But we know that many Black midwives who've been paramount to providing maternal and infant health outcomes did not actually need those certifications in order to have safe deliveries. And in fact, with the work they do that is low risk, they continue to make up the midwifery midforce of certified midwives, certified nurse midwives, are actually only 7%. So we know the importance of fixing the maternal and infant health disparities that exist. We must engage in the word Sankofa. It's a word from Ghana that means go back and get it, go back and retrieve it, and be with it, meaning the legacy of African midwives, traditional midwives, and granny midwives. So it is our honor as House and Senate today to honor this rich legacy and to present the 2024 Black Midwives Day resolution to you, Georgia's incredible honor, Salama.
Thank you so much.
You are welcome. You are very welcome. And at the same time that we celebrate in moving midwifery forward, I have to think about last session when the House presented a resolution, House Resolution 559, to Charles Johnson. Charles Johnson lost his wife, Kira, to internal hemorrhaging after a C-section at a hospital. He started the organization For Kira for Moms, which is a nonprofit dedicated to improving birth outcomes. He has been here with us advocating for the issues. He brought the surviving children of him and his wife, Kira. I'll hold the photo of him up here as to the time he spent with us in the House. And I will invite Karina Edwards, a midwife here in Georgia, who works with the Safe Motherhood Quilt, to receive his resolution and to provide a few remarks before returning it back to Senator James for closing.
Thank you.
Thank you. Thank you, Representative Cannon. Thank you, Senator James, for all your work and support. The Safe Motherhood Quilt is something that was started in the 80s, and midwife Ida Mae Gaskin had founded it, and she began to do a lot of research where she would question every death, because a lot of the mothers that were dying from the use of Cytotec, were dying from cardiac arrest, which everybody dies from cardiac arrest. So it was sort of a head-scratching moment of why is this happening? And instead of just taking the word from the doctor, you know, she did some investigating. She would try to talk to the family. She would talk to the medical examiner and the coroner. She would talk to the hospital attorneys, because, you know, they would write one thing down and then the hospitals would make a decision of what that cause of death was, and then by the time it got to the families, a lot of the families didn't even know. And so Charles Johnson has been really advocating and pushing for laws nationally to help improve just the communication and the accountability of these care providers in these hospitals, and the checkbox as far as how did this mother actually die, what led to her death. And you know, Kira Johnson, she is one of the mothers that is honored on the Safe Motherhood Quilt. The mothers that are dying, you know, at the end of the day, it doesn't matter what your socioeconomic status is, it doesn't matter what your level of education is. A lot of the practices that are happening is what's leading to a lot of the mothers dying. And so Charles Johnson, again, you know, after losing his wife to such a horrible, negligent death, has been fighting on behalf, as well as several of the community midwives and others, to just try to help shift things and make it so that women can live through birth, Black women can live through birth, all women can live through birth. And thank you again for recognizing Black Midwives Day and for supporting this work.
Awesome. Senator James?
Well, as a mother of two sons, I did not have the opportunity to have a midwife, but I regretted it for many, many years because all of my sisters who did have births with midwives are healthy and their babies were healthy. And so I wish that I had had an opportunity to have mine delivered by midwife. But I'm here now to fight for the mothers because mothers are not dying in the care of black midwives. They know the culture. They touch us emotionally as well as physically. And they care for us and our babies, who are really trusted by the community too. So let us continue to recognize the importance of the legacy of black midwives and all midwives throughout the state of Georgia. So today, we thank you for listening to us, and let us continue to change the laws, because this should not even be a topic of conversation. It should already be done. So together we stand. Thank you.
Thank you.
Thank you.
We would love to answer any questions, or you want
Yes,
her
so
to
we're
come
actually
up with
joined by another representative and her guest, who is a doula, and so we would like to invite them up at this time. And we have another midwife who also is here. So we just want to add to the space and have you come stand with us. And Representative Glaze will let you go ahead and present that resolution.
Well, thank you. And I'd like to say I'm standing for mothers in Georgia, but particularly black mothers, as I am a mother of 2 sets of twins, 2 pregnancies that could have ended in my children not being here and even myself. But I had insurance and doctors and family around to make sure that I was supported for the 9 months that I carried my twins and was on bed rest. So that gives me the idea from the cup half full, making sure that we leave nobody behind, and that doulas and midwives have been and are the bedrock in our communities for making sure that our women are healthier during their perinatal period all the way to a year after their children or child has been born. So in House District 67, which I am the representative, Lydia Glaze, we do hereby commend and recognize Mayor Teresa Thomas Smith, who is the first African American and first female mayor of the city of Palmetto. But more importantly, we recognize her as the women's mortality queen of the District of 67 because of her work as a doula, and I would like her to say just a few words.
Yes.
Thank you. Thank you very much. Thank you for this opportunity. I would like to say this work is serious work, and not a single person that is standing here chose the work. The work chose us. There's so many mothers that do not have anyone to speak. I had amazing birth experiences. But when I heard the stories of my sisters and daughters, and I don't mean the ones that I birthed, I mean the ones that I shared the human experience with. When I heard the things that were happening to them, I also heard the cry of the God that I served that said, it's your turn to pour back. The things that the gifts that I've put into you, give them back to the sisters and daughters that do not have anyone to speak on their behalf, that do not have anyone to advocate, that literally just do not have anyone. And I don't think people know how many people go into the birth experience with no one at their side.
That's right.
That's why midwives and doulas are so important to the experience and to the mothers that are having babies. So I am grateful that I heard the calling. I'm grateful that I was courageous enough to answer the calling. And I extend myself to those that need support, whether on either side of the birth experience, mothers, fathers, and families, because we represent and support the entire family holistically and not just the mother and the baby. So thank you for this opportunity. Thank you for championing this cause. Thank you for recognizing that we are a unit and we are stronger together, and we can do this when we all come together to do this. So thank you very much.
Thank you. Madam Mayor.
All right, I think we're set. Thank you.
Thank you.
Alrighty.
Thank you.
Good.